If you're dealing with osteitis pubis of the hip and pelvis, what is it and how can you get better? I'm Dr. David Geyer, orthopedic surgeon and sports medicine expert. I share sports, exercise, and injury information, as well as stories from some of the world's best coaches and athletes to help you become a champion in sports, business, and life. Osteitis pubis is fairly rare as far as conditions that affect athletes and active people, but for the small percentage of people that have it, it can be really difficult. This is basically an inflammation of the symphysis pubis. If you look at my model of a hip, if you had two of these, this is the area where the pubic bones come together, right sort of in the front of your groin. It's typically an inflammation that you see in athletes and active people that do some sort of sport that involves coming across the body in a repetitive motion, like soccer players or hockey players. But it can really affect anybody that does a lot of cutting, changing directions for their sport. Again, it's typically an inflammation that comes on over time rather than after a specific traumatic event. But most people that have this complain of this dull, achy soreness right in the lower part of their pelvis and groin, sort of right down the center. Again, most of the time with physical activities. So when they're changing directions and maybe kicking a ball across the side of their body, something like that. But in people with it, yes, I say it's a soreness, but it can really limit their ability to play sports the way they want. Now, fortunately, the treatment is almost always non-surgical. Surgery is really a last resort, and a lot of people think there aren't really that many good surgical options. So initially, we talk about things like anti-inflammatory medications, a short-term period of rest to limit the activities that cause the pain in the first place. Sometimes it's working with a physical therapist on strengthening the muscles around the hip and the pelvis and groin to take pressure off that bones to get that area to heal. Occasionally, you hear people talk about even getting injections into that symphysis pubis, the joint between the two pubic bones, to see if that relieves it. Again, it can be a long course of treatment. It's not something that typically goes away right away, but almost all the time that's effective to get people better without surgery and to get them back to sports. If you want more information on injuries like these that can really help you get back to what you love to do, click the video below. I look forward to seeing you much more really soon. Take care.